Well, thanks everyone for being here for our live summit session on death investigation. I have a presentation and a panel for you all, so I'm pretty excited. We have Sean Hurst with us, Patty Kenyon, and then Ken Mulkey. I have Sean and Patty spotlighted for you all. Ken is joining us by phone because he got called into work, so you won't be able to see him, but he'll still be able to contribute his thoughts, and you'll still be able to ask him questions. So I wanted to start off just by letting each of them introduce themselves, and then Sean's gonna give a little presentation on some death investigation basics, and then we'll open it up for questions. So Sean, do you want to start off introducing yourself?
Sure. So my name is Sean. I am a trained and certified forensic pathologist, and I'm also the chief medical examiner of the state's medical examiner program. I hope you don't hold it against me too much, but I'm actually from the East Coast. I grew up in Staten Island, New York, and did my schooling and residency in New Jersey, and then did my forensics training in Miami-Dade County in Florida. From there, I worked for a few years on the west coast of Florida, and then my wife and I decided to move out here for a change of scenery about 3 years ago.
Well, you've kind of hit like many corners of the country, so you just need to go like, I don't know, Southern California, and you'll have a nice little block of continental US.
We feel really grateful that we've been able to experience life on both sides of the country.
It's definitely different. Well, thank you, Sean. Patty, I'll have you introduce yourself next.
Sure, and we're glad to have you, Sean, by the way. So I'm Patty Kenyon. I am the forensic nurse coordinator with the task force. I have been a SANE nurse certified since 2004, doing sexual assault exams since the late 1970s when I was originally trained. I started doing death investigation about 12 years ago. So for Lynn and sometimes Benton County. So.
Thank you, Patty. And Ken, I'll let you introduce yourself now.
Good afternoon. My name is Ken. I am a retired firefighter paramedic, 30 years in emergency services. I got tired of being retired, so I went back to work part-time, and I think I work more now than I did before I retired. About 5 years ago, I became involved as a medical death investigator for Polk County, and had the opportunity to also join Lynn County about 2 years ago.
Awesome, thank you, Ken. And just so folks know, both Patty and Ken are kindly joining us while they're also juggling call. So if either of them has to step out, you know why. It's not because they decided our company wasn't worth it. They're doing a great service for us. Okay, so I'm going to go ahead and turn it over to Sean for a little presentation here.
All right, I think we figured out how to do this just before the meeting. So great. So you guys should be seeing my slides now.
Looks great.
Great. Okay, well, I will get started then. As I mentioned before, my name is Sean, and I'm the Chief Medical Examiner for the State Medical Examiner program here in Oregon. We've got a little presentation for you today where I'm going to provide you just a brief overview of what death investigation entails in Oregon and what our system looks like. From there, I can hand it off to Patty and Ken to give you any more specifics that they might be able to show about what the day-to-day job looks like, because that's what they do. And then I'm sure we'll have plenty of time at the end for questions. But if anything does come up while I'm talking, feel free to type any questions into the chat box and we can circle back around to them later. So I'd like to start this presentation off just by asking a simple question, and what is the purpose of death investigation? Now, I think that's an important question because most people are really unfamiliar with what medical examiner work is and what forensic pathology is specifically. And so I'd like to answer that question somewhat obliquely with this quote. I really like this quote because it implies that, care for the dead and investigation of deaths is something that benefits society as a whole, rather than being focused on any one particular part of societal functioning. And I think that that's a common thing that you'll find in people that are drawn to this type of work. Oftentimes we do find ourselves speaking for the dead, And there are some definite, public health benefits that good death investigation has that we'll mention a little bit later in this presentation. So first, a little bit of history. Oregon is actually one of the older medical examiner systems in the United States. It was the first state to convert from a coroner system to a medical examiner system west of the Mississippi. And this happened in 1956. The impetus for this was something that was published via a work group in Congress called the Model Postmortem Examination Act. And one of the things that this document emphasized was that death is a medical problem and the investigation of death is a scientific pursuit that should be undertaken by medical professionals, including physicians. Prior to this, all death investigation in the United States was performed by coroners rather than medical examiners. And we won't necessarily get into it today, but there are some distinct differences between a coroner and a medical examiner. Now, there was a big push and there was a lot of motivation between the 1950s and the 1970s where a lot of coroner systems changed over to medical examiner systems, but the pace on that has since slowed in the modern day, and this is relatively uncommon now. But our setup is basically that we have a state medical examiner's office, and then each county theoretically has a county medical examiner that oversees the activities of county medical legal death investigators, or MDIs. So this is what that looks like schematically. So I directly supervise 5 additional forensic pathologists in the state that all work for the state medical examiner's program. And I myself am also one of those practicing forensic pathologists. Then we provide what's called technical supervision to the county programs. So each county is responsible for maintaining its own death investigation program and appointing a county medical examiner. We then provide the best practice recommendations for what the day-to-day activities should look like. And then again, theoretically, the county medical examiners oversee the activities of the county death investigators. So on the ground, this is what that looks like. So every single medical examiner case obviously will begin with a death. So first responders or other medical professionals will determine that a death has occurred. From there, if the death meets certain circumstances, county medical legal death investigators, or MDIs, will be contacted. From here, the MDI makes probably the most important decision of any case or any part of any case that's made in the state. And that is they determine if the death fits medical examiner jurisdiction. So is it an ME case or is it not? If it is, then they'll begin the death investigation process. So they'll begin to collect all the information about the circumstances surrounding this particular death, gather whatever information is known about the person, and then package that up into a report that will be reviewed by the county medical examiner. The county medical examiner then further triages the case to determine what other steps need to be taken. Now, this could include just certifying the death with the information that they have available to them. It might mean ordering some toxicology testing or other ancillary tests, or it may warrant consultation with our office and consideration for a postmortem examination, which will occur in one of our facilities in the state. So basically in Oregon, healthcare professionals of multiple different levels can certify deaths, which is a little bit different than in other states where death certification is almost exclusively given to physicians. So the catch in Oregon is that the other, in addition to physicians, other levels of healthcare providers that can certify deaths can only do so if the death is natural and does not fit medical examiner criteria. If a death does fit medical examiner criteria or is not a natural death, then only a medical examiner can sign the death certificate. And ORS 146, which is our state medical examiner law, establishes that county medical examiners must be physicians. So the end result of all of this is the production of a death certificate. Now, the death certificate, I think, is an underappreciated vital document because it's something that's absolutely essential to family members. So a death certificate is objective and incontrovertible proof that an individual is in fact deceased. Now, this allows family then to begin the process of disposition planning and estate management. And a big portion of this is claiming assets, either physical assets or monetary assets that may belong to deceased individuals. Without a death certificate, none of this can occur. And unfortunately, when death certificates are not filed in a timely manner, then sometimes financial harm does befall family members. So this is something that we're very, very sensitive to in our office, because if we have the opportunity to help families out to provide death certificates for them just so they can proceed with this process, we generally do what we can to make sure that it's done in a timely manner. Now, unfortunately, systems rarely work as they're designed. One of the things that I mentioned up front here that really does impact how we do our job is that very few people, sometimes even people working indirectly with the system, really have a good understanding of how we do the job and what it entails. This may sound kind of silly, but sometimes a lot of what people think about medical examiners and forensic pathologists is derived from what they see on TV. We sometimes refer to this as CSI-itis or the CSI effect. And while it's useful in the sense that it does get people interested in what we do, it sometimes is detrimental because the way we work in real life is markedly different from the way that it's portrayed on TV. I actually just had a conversation with someone about this exact topic based on a significant misconception about what my exam entailed just before this conference. So this is definitely something that's relevant. Unfortunately, too, our system looks really good on paper, and it looks like it has an established hierarchy that's established by our state law. But in practice, it's pretty convoluted and exists within a complicated bureaucracy of things that occur at the county and state level. There are lots of different agencies that feed into death investigation. And sometimes it's not always clear who is supposed to man any particular activity. But one thing that's consistent across the state is that nobody really wants to pay for death investigation, which can sometimes cause issues. So the end result of this is that, unfortunately, expressions of grief and sometimes even anger are sometimes par for the course when it comes to death investigation. And so anybody that's interested in participating in the death investigation system should be prepared for that. Some of that too is understandable because you have to realize that you're interacting with a person during a pretty horrible time in their lives, and that will certainly impact how they interact with you. Another significant challenge that we face is that our system has not really grown appropriately with the contemporary era. Our medical examiner law in general hasn't seen significant amendments since 1973. And unfortunately, the ME office at the state level hasn't seen significant funding or staffing increases in over a decade. So what that means is that the staffing in our office is scaled to a population that is much smaller than the population that we actually cover. The population in Oregon has grown quite dramatically in the last 10 years. And has actually doubled since we've seen significant increases in the staffing of our system at the state level. And this is definitely true for county level programs as well. So the increased caseload and just the increased number of people in the state is definitely straining the death investigation system right now. So moving on and changing gears a little bit, as I mentioned before, the single most important decision about what that has to be made in any particular case is whether or not a case fits medical examiner jurisdictional criteria. So ORS 146 is the law that gives people who participate in the death investigation system their mandate to investigate deaths, and it also sets the jurisdictional criteria for the cases that we handle. Now, every state has one of these laws, and they do differ slightly from state to state, but this portion of the law is usually pretty similar across the United States. And the broad strokes of it is that any death that's not natural in manner probably fits medical examiner criteria. Now, this obviously includes traumatic deaths like homicides and suicides, but it also includes any death that might occur under suspicious circumstances. Now, definitions of that vary, but there's a pretty low threshold for that here in the state. Any accidental death is also going to be a medical examiner case. Now, this involves deaths due to exposure to drugs and other toxic substances. It includes traumatic injuries like motor vehicle accidents, and it includes deaths that occur while a person is engaged in their usual occupation. Another common subset of medical examiner work are in custody deaths. We are always involved in these types of cases. And generally speaking, we will perform an autopsy most of the time in those types of cases. We also get involved when there is deaths due to what might be considered a threat to the public health. And finally, if a person dies in a way that's most likely natural, but doesn't have a established relationship with a healthcare provider, we'll generally investigate those deaths and pick up those death certificates as well. We won't necessarily perform autopsies in those cases, and we often don't, but the certification usually falls to medical examiners at either the county or the state level. One last bit about our law that's a bit unique is that anything in which a body has been disposed of in an offensive manner becomes a medical examiner case. I haven't seen that used since I've been here. I imagine it'd be pretty uncommon, but that's out there too. So functionally, this is what the state looks like if you look at all 36 counties. The counties that are shaded in green are counties that have well-funded, robust death investigation systems at the county level. So this basically means that they employ full-time death investigators that are usually certified by the American Board of Medical Legal Death Investigation. So these are the counties that we basically participate most directly in the death investigation system. And these are the counties that work as close as they can to traditionally structured medical examiner systems in other states. And you'll notice that they're concentrated in the metro area. So basically Portland and Eugene. Blue counties, on the other hand, don't have county MEs or full-time MDIs. So we generally cover these counties, but death investigations are unfortunately sort of an ad hoc, have an ad hoc type approach. And we sometimes don't get a whole lot of information from these counties about particular deaths. And so certification of those deaths and investigation of those deaths can be somewhat challenging. The red counties, which encompass most of the state, are counties where there is an appointed county ME and then no full-time death investigator. So in these counties, usually it's people that are cross-trained as death investigators that have another full-time job. Most commonly across the state, these are actually law enforcement officials who are cross-trained as death investigators, which is something we'll talk a little bit more in detail in a bit. The only exception to the rule, and the one that functions, I think, in the real spirit of ORS 146 is Marion County. Marion County has a county ME and they have full-time death investigators, and they actually have a very, very well-managed program and some of the best death investigators in the state. So I think it's useful then to break down what the responsibilities are for people at the county and the state level. So at the county level, you can think of their activities as the day-to-day routine activities of death investigation. So this includes things that happen basically at the scene and on the ground. So that includes the response to the scenes, that includes scene investigation, that includes scene photography, and documentation of the scene in terms of the medical examiner report. There's also a degree of data entry in our case management system, as well as interfacing with other things at the county level. So if there are medical records that need to be procured, generally it is county death investigators that procure those for our review. And if there's any other either conversations that have to happen with social contacts or next of kin, such as notification of the death, or interviews to gather more information, that typically occurs at the county level. When it's not feasible to transport a body to us, such as when it's far away, or it's not a particularly high profile case, then county death investigators often do perform medically oriented external examinations as well. And that's something that we do at the state level as well for bodies that come to our facility. At the state level, you can consider our responsibilities to be more specifically focused on the practice of forensic pathology. So this includes the autopsy and all the stuff that supports the autopsy practice. So this includes our documentation, which is autopsy photography and the generation of an autopsy report. We also have the capability to perform limited radiography on cases where it's indicated. And then we also generally approve of or authorize ancillary tests, most commonly toxicology. We then are responsible for the interpretation of those results because that falls most cleanly within our expertise and our training. As I mentioned, medical record review is something that generally occurs at the state level, and we, we review thousands of pages of medical records per year when it comes to our cases. And finally, you'll notice that death investigation occurs at both the county and state level, depending on if a county ME is appointed in the county where the death occurs. So the bottom line here, I think a really important point to mention, is that while we do have a state medical examiner's office in Oregon, Oregon's medical examiner system really is a state system in name only. And that's basically because we don't have the funding or the resources to offer forensic pathology services consistently statewide, and we tend to be most aggressively and most directly involved in death investigations in the metro areas. As I mentioned, there's a patchwork of county systems where each of the 36 counties approaches this in a slightly different way. It is required that each county maintains a death investigation system, but there's no real documentation of what a death investigation system should look like at the county level. And then what the state can provide is basically just recommendations of what that should look like based on the resources that the county has to its disposal. So you'll notice across the state that there's a wide variety in funding and resource allocations for each of the county systems, which definitely affects what death investigations look like in each individual county. Unfortunately, too, counties sometimes have different approaches in how they communicate with us at the state level. Some do a very good job and do so on a daily basis when we're involved in cases. Others we rarely hear from, and sometimes we only speak to them when there's a case for us to handle, such as a homicide or something like that. So from here, we'll shift gears a little bit and start talking more about the role of the death investigator. And the medical legal death investigator can be thought of as the functional unit of death investigation in Oregon at the county level specifically. And we'll only be talking about this in the broadest of strokes here because Patty and Ken, I think, can give you a much better accounting of what this job entails than I can because they're doing this every day and they are, as I mentioned, on call currently. So as I mentioned before, death investigation in ORS 146 and in the hierarchy that I described previously is that death investigators are supposed to be under the direction of a county medical examiner. Now, ORS 146, specifically removes death investigators from the law enforcement chain of command, and that's by design. Now, unfortunately, in practice, that's not a very common setup statewide. So the vast majority of death investigators statewide are cross-trained law enforcement officials who sometimes wear the same hat when they're investigating deaths, as they may be the person that's investigating a death from the law enforcement side and from the medical examiner side simultaneously. Ideally, these things should be separate. But in the state, this is a really, really common setup that we have based on sort of historical developments and how the system has evolved over the years. Now, when it comes to MDIs, regardless of what agency they work for primarily, there is an established appointment process. And that is that the county medical examiner, if one exists, is responsible for appointing MDIs. This requires approval from myself at the state level, but it's a rare situation where we say no to an appointment because we recognize that death investigation is a really important activity that has to occur consistently and has to occur in a professional manner every single time. If a county medical examiner doesn't exist, generally it falls to the county district attorney to appoint a medical legal death investigator. Now, a secondary thing that death investigators can pursue in Oregon is certification as an Oregon death investigator. And this occurs through participation in what's called OCMDI, and that is what we refer to as the death investigation course that our office puts on a yearly basis. This is a week-long course that we provide at some point in the year where we cover a wide variety of relevant death investigation topics and forensic pathology topics specifically. It's not required that a death investigator be certified, but it certainly is recommended. We've only missed 1 year on this. We missed last year because of COVID, as it was difficult to coordinate with all the other stuff going on, but we are going to put this on this year in October. So the most important thing that a death investigator does is that they act as the eyes and ears of the medical examiner. There are some medical examiner offices out there where physicians routinely go to scenes, but Oregon is not a system that works like that. Because there's only 6 forensic pathologists statewide, and if we were responsible for going out to scenes, that's all we do. We'd never be able to do anything else. So we really do rely on MDIs to provide us the information that we need. An MDI can be considered an observer and a reporter. It's really important for the MDI to start the process by 1, establishing jurisdiction and triaging the case appropriately, but then recognizing all the steps that need to occur in the beginning of the death investigation and all the relevant information that must be collected so that they can report that to us. And then with that information, we can then decide what further steps need to be taken in a death investigation. And more importantly than that, or at least more importantly, in my opinion, is that it allows us to offer the most informed opinion of cause and manner of death that we can, which I think has a lot of importance for the public health system as well as for families. So this is generally accomplished by scene visitation. And MDI's presence on scene is absolutely essential for a good comprehensive death investigation. And MDIs on scene are responsible for asking logical, common sense questions that will be able to provide objective, accurate, and consistent information about the scene to us so that we can use that to make our determinations. It's really important that MDI have established relationships with all the other people that they'll be working with on scene. This includes other first responders, such as law enforcement, as well as the medical first responders, who can sometimes give you invaluable information about how the person presented prior to death and what other resuscitation attempts were undertaken before the person expires. Law enforcement as well can give you a lot of good information about the circumstances and sort of the legal suspicion in cases. However, in my opinion, the most important part of a medical death investigation is often something that we don't always get a whole lot of information about. And this is the medical background investigation. In my opinion, every single piece of a case that includes, what the scene looks like, how a person presents, what the external exam findings show you, what the internal exam findings show you, how you interpret your toxicology, all of this should ideally occur through the lens of a person's medical history. And this involves not only asking questions of next of kin and a good scene investigation with a focus on things that might imply a person's medical history, such as medications or evidence of doctor's visits, but also being able to procure medical records. Now, being able to procure medical records is something then that requires a person to have at least a little background medical knowledge, as well as a pretty good grasp of medical terminology and medical abbreviations. Because as you guys, I'm sure, have seen, that even sometimes straightforward hospital visits can generate hundreds of pages of medical records. So it's really important for people to have an idea of what will be useful for us to sort of streamline the process of getting those records for us for our review. Now, this brings up a really important distinction in my mind, and something that's definitely worth talking about going forward as our death investigation system continues to evolve. Now, I think that healthcare professionals or people with medical backgrounds are really well suited to perform death investigations because you guys are already used to doing all the things that we've talked about in this talk so far. And again, that further underscores the fact that death investigation really is a medical pursuit and a scientific pursuit. So for example, anybody with a medical background is usually going to be familiar with human pathophysiology and be able to provide really good, accurate medical information about decedents. You guys already perform physical exams on living patients, and that's essentially what we do in death investigation as well. We examine bodies and look for external manifestations of internal diseases. The only difference is that we don't have the benefit of being able to ask people direct questions as we're performing the examinations. You guys will also be familiar with medical terminology, which really helps for us when we communicate about cases, because we'll basically be talking the same language. Also worth mentioning here is that you guys will be really familiar with medical abbreviations. And sometimes something that causes me a bit of consternation is when I review medical records where physician notes are basically just long strings of acronyms rather than actually having, good descriptions of procedures and the patients that they see. And finally, as we mentioned before, you guys basically will have, established relationships with healthcare facilities and have access to medical records, which means that you can, lawfully procure them to provide them for us. Now, this is something that a lot of law enforcement agencies really struggle with, which is not to say, it doesn't sound like I'm undermining the good work that a lot of cross-trained law enforcement MDIs do. It's just a lot of times healthcare facilities feel uncomfortable offering medical records to people who say that they're death investigators, but also work for a local sheriff's office. Sometimes that can be seen as liability for the healthcare facility. That wouldn't be necessarily an issue for people that are already plugged into the healthcare system. Now, on the other side of the coin, things that might be slightly disadvantageous in this discussion basically is that this would be an uncommon setup statewide. So there may just be a lack of familiarity with participation of healthcare professionals in the death investigation system because so much of it is manned by people who are part of the law enforcement apparatus of the state. That's not to say that that would be an insurmountable problem. it's just certainly something that would probably come up as people explore avenues where they may be able to participate in the death investigation system. All of this is to say that, again, death investigation is, in my opinion, an important public health activity rather than a public safety activity. Now, I think one of the byproducts in Oregon, of having so much of the death investigation workforce be cross-trained law enforcement officials is that there is definitely a public safety focus when it comes to death investigation. So oftentimes when we get reports of death investigations that we review, there is a really, really good and comprehensive job that's done in terms of addressing the scene findings, anything that might be considered suspicious or not suspicious, and sort of the legal context of the death itself. But one of the things that I find endlessly fascinating about this job is that people with different backgrounds often look at the same information and then come to different conclusions. And oftentimes that is a byproduct of your training and your educational background. So in my mind, people who have healthcare backgrounds, people who have law enforcement backgrounds naturally are complementary when it comes to death investigation. So this is interesting to me because only about 3 to 4% of our cases have a significant medical legal component to them. The rest of them fit cleanly in the public health realm. Ideally, well-funded medical examiner systems can influence and participate in the public health system in a variety of ways. One of the real big ones here is mortality trends. Now here we're not necessarily talking just about raw numbers of deaths by different mechanisms, but ideally in systems that are well funded, this can be parsed out along socioeconomic lines, along racial and ethnic lines, along county lines, and really does help identify significant issues in vulnerable populations. The goal of which is to be able to produce good targeted interventions to work on preventing certain types of deaths. One thing that I think is underappreciated is that medical examiners often contribute to understanding of emerging diseases. This is certainly true of COVID-19, and a lot of the pathophysiologic information that was produced in the early days of COVID came from autopsy studies. There was also an increasing influence of genetics in death investigation and in public health. Again, the idea is that by identifying certain populations that might be predisposed to certain mechanisms of death or certain medical problems, is that you could then identify and create targeted interventions for them to protect the overall community. Oftentimes, public health officials are very, very good at communicating with the general public. And as I mentioned before, one of the key hindrances that we have sometimes is that the general public really doesn't understand how we do our job. And a lot of that is our own fault, and that we haven't really been particularly good about communicating and educating the general public about the work that we do. And so, that definitely, I think, has a public health dimension to it, because there is often good avenues to communicate about the types of deaths that occur in the community directly with the community at large. And finally, mass fatality management is something that's worth mentioning when you're talking about medical examiner work, because while a definite part of mass fatality management includes the public safety apparatus of a jurisdiction in which a disaster occurs, there is a definite public health interest in compiling accurate statistics of deaths that occur in a mass fatality event, as well as being focused on identifying unidentified human remains and ultimately reuniting them with their families, which is really the core of what medical examiners do. So just a couple examples of that. I don't know if you guys are aware, but the first COVID case in the United States was actually identified by testing a blood sample that was procured at the Santa Clara County Medical Examiner's Office in San Jose, California. Which, when you think about it, this makes total sense that before a certain illness is identified in the healthcare system, and before you see the spikes of hospitalizations and unfortunately, ultimately deaths that occur with an emerging infectious disease, you have to assume that this is circulating in the environment prior to it coming to the attention of the healthcare system. And this is certainly true of COVID-19. And this first positive test was actually significantly before it started popping up in hospitals in the United States. And this is just to plug some of the work that we've done over the last year. And this is a couple of photos from the mobile morgue deployment that occurred last year as part of the state's wildfire response. So you'll notice next to me, I'm the guy in green scrubs there. To my left is Patty Kenyon, who was a big help and a major participant in making sure that that operation was a success. And we really appreciate her assistance in that response. So before we wrap up here, just a couple notes about things that I would love to see going forward for Oregon's death investigation system, and ideally I want to really work on continuing to identify the public health importance of our activities, and observing that distinction from the law enforcement apparatus in the state. One of the major long-term goals of myself and the chief medical examiners that preceded me would be to have medical examiners' offices strategically located throughout the state that would allow us to really offer comprehensive and consistent services to every member of the community, which unfortunately we can't do right now. And also too, we would love to work on becoming accredited by the National Association of Medical Examiners, which is our national governing body. And it's an important designation that establishes the independence and objectivity of a medical examiner's office that unfortunately right now, we wouldn't necessarily qualify for accreditation criteria based on our staffing numbers and our funding. So I just wanted to throw this out here preemptively, because this may be a question that comes up either later today or in the future as people have time to mull over what we're talking about today. But what can you do to get involved? A lot of this is going to depend on the county in which you are interested in participating, because the systems are all slightly different in different counties. But really, it's just a matter of knowing your county partners and knowing how the medical examiner system is organized in that particular county. That'll allow you to figure out what you need to do to participate in the established appointment process that we talked about earlier. I think it'll be really important, regardless of anything else, to communicate with county law enforcement, because I'm sure that they would be very thrilled to have assistance and have an extra set of hands, especially people that have medical backgrounds participating in the system. I imagine that would go over pretty well in most counties. And then if all else fails, you can always give us a call. Although I am pretty busy these days with all the craziness that's been happening in Oregon over the past year and a half. I do strive to be as accessible as possible, and I try my best to return phone calls and answer emails in a timely fashion. I don't always hit the mark, but I make an effort. So with that, I will offer up my email address and our office phone number in case anybody would like to reach out to us in the future. And here I will hand off to Patty and Ken, and I would welcome their input in our talk today.
Thanks, Sean. I can tell you Ken has been called away, so.
Oh no.
So it's just me. So I appreciate all the information you've given. When I started doing this, I'll just give you a little background. I was asked to do this by a nurse who was had previously been working as a death investigator in Lynn County. And it was primarily because I was used to working with law enforcement because of doing my SANE work. And I don't recall ever saying, yes, I'll do it. I just sort of got dragged in. I know I was appointed, but I have no memory of that happening. So it really was very ambiguous, the whole process. I work in a county now with just Lynn County that has 5 nurses and Ken, who we have 2 physicians who work as the county medical examiners. When we are notified of all deaths that occur in Lynn County, with the exception of hospice deaths, unless there is something suspicious about the death, or the death was the result of an accident or drug intoxication. So while we are not a very populated county, we are a large county. If I respond to all deaths, it can take me up to 2.5 hours to get to the top of the mountain pass. And that's if it's good weather. So when I see my job just like all my nursing background, which is primarily emergency room. I get a call, I triage it. is this something I need to go out and see right away? Do I go see them in the funeral home? Or do I need to see them at all? And it's really listening to the law enforcement agent that's calling, and also knowing who it is you're working with. I know if I have somebody, if the sergeant says this is officer so-and-so's first death investigation, I'm going to come out because this is my chance to, one, teach him on things to look for. The sergeant is doing a great job of teaching him about the scene. But the body is mine. And so I'm going to be talking to him about things that I would like to know when they're calling me, and to make sure to call me earlier rather than later, because then I can start looking at medical records. I can start looking, talking to physicians if the office is open. So when I respond to the scene, I'm looking at safety of the providers. There have been a couple of times that I've said, hey, we need to stand back. We cannot be going in there. And so there's that aspect also. And I'm looking at safety for the families. When you go out to a scene and there's nothing but children there, you're working with making sure those kids are safe, that people are the appropriate people to care for those kids are being called. And then I look at the body. I basically take a history. I observe, and then I give a report, whether it's to the physician, their personal physician, to ask them if they'll sign the death certificate, or if it's to the county ME, or to asking the state ME. I work very autonomously, but I have backup. Unfortunately for Sean and the others, I would not hesitate to call in the middle of the night if I really had a problem. I don't think I ever have, but it's not something that I would shy away from. It is, as Sean said, it is not a well-paid position. I look at this as my volunteer work to my community. It is not something that I could, because I'm not full-time, but also even if I was, I don't know that I could support myself on my salary. So that's a drawback. It would be hard to do that full-time. But it's incredibly rewarding, I think, to help families. Personally, I like crisis work. And I like putting together puzzles. So it is looking at the body, at the scene, at the history, and what the people, the families are telling you, the physician is telling you, or PCP, and putting together what has happened to that person. And I think another important part, since I am a medical person, is to really look at the welfare of the people who are still in the home. There have been times when I've called for Adult Protective Services, DHS, to make sure that people have what they need. I've also called to get animal control in to take care of the dog that's left, the farm animals, if there's nobody else, if there's no family members. So it is really looking at the whole that person's whole community. So, and the other part is we have a chaplain that responds anytime we need, for both first responders, myself, as well as family members. So getting support out for people. Did I leave anything out, Sean?
No, that's great. I'm really glad that you emphasize the point of, also considering the people that are left behind when a person dies. that is definitely something I think is underappreciated, is the interactions we have with the living. People do just assume that everything we do is pertaining specifically to a deceased person, but there's a lot of other things that, impact and are impacted by a person's death that I think are underappreciated.
Yeah. And there are times when I will have many, many calls from families. They think of one more detail, one more question. So I think the longest I had a mom call me for up to a year after her child died. And they need that support. And obviously they can't be calling the state office with all those questions. So we can help field them.
And thank you for looking after the animals too.
Yes, I sometimes have a hard time not bringing them home, but so. Nicole, do you have any questions in the chat or anything?
No questions in the chat yet, but folks feel free to put some in, and we are happy to share those with Sean and with Patty. I just wanted to say, first of all, thank you so much for that information. I, have a little bit of familiarity with the death investigation system, but I just learned a whole ton from both of you. And the complexities are really something.
I have one more thing to say.
Oh, please. Yes, absolutely.
It's, as Sean was saying, each county does vary slightly. I think many of you know Chris Karcher, who is down in Coos County, who was one of my mentors. She has, while many of the things we do are the same, she also has additional responsibilities in that she works for the DA's office. She does respond to living victims as well as decedents. So when they have a domestic violence or abuse of some kind, she will respond to the hospital, to the scene, to help document those injuries in great detail. She teaches all the law enforcement agencies about death investigation. And for the SANEs out there, she does perform sexual assault exams on decedents. I've done it a couple of times, but her DA allows her to respond to multiple counties in southwestern Oregon. So.
And Patty, could you elaborate a little bit more on what a sexual assault exam, how that looks different on a decedent versus a living patient? Just because I know we have some SANEs on the call today and some others who will be listening. And I know there are some important differences, and I don't actually know much about what those differences are, though.
So Sean, you can chime in anytime. So I have only done those exams when it is at the scene of a homicide. So I know that person is going to be going to the state for an autopsy, but when there's fear of losing evidence by putting them in a body bag, in a cooler, and not sending them up immediately. So it is basically done the same. It's just like doing an exam on somebody who has no memory of what has happened to them. I document injuries. I document what I'm seeing, their state of dress, what the clothes look like. The one thing that I think of as being very different after somebody has died, depending on the length of time, the tissues can start breaking down pretty quickly. So one, I would never do a speculum exam on somebody. I would never do an anoscope exam. And I most likely would not do internal swabs on anybody, absolutely anybody over 24 hours. I probably would stop at 12, and that's if I know exactly when they died. But I would definitely get those skin specimens, because those are the ones that would be lost being in a rolling around in a bag in a sheet, rubbing off. Sean?
Yeah, Patty brings up a really, really good point in how important it is to collect trace evidence on scene. Ideally, that is where trace evidence collection occurs, is basically as soon as possible and before anybody really has a chance to touch the body. Because we can do that here too at the state facility. We often do perform safe kits or sexual assault evidence collection kits. We do documentation of injuries as well. We can perform very limited photography on them too. But exactly as Patty is saying, it's if that particular sample has a lot of evidentiary value, it's really in everybody's best interest to collect that as soon as possible, preferably with as short a distance between the collection of the specimen and the law enforcement agency that's going to be accepting that piece of evidence. And that's definitely a gap that exists right now in Oregon, is that there aren't many people out there that are like Patty and Chris Karcher that have this cross training, because I think that's really, really important for something to happen on scene that doesn't always happen. I will add as well that one of the things that is a little bit different that we'll do as well at the state level if a case does come in, and again, if there's a significant suspicion of sexual assault and then a death involved in it, that's probably going to be coming to our office, because that would be considered definitely a suspicious or higher profile case. And that is that we can also procure tissues to look at under the microscope, which you can't do in a living person for the obvious reasons. And that sometimes does have evidentiary value as well, because we can identify infections possibly, or underlying injuries that may not be as prominent to the naked eye. One thing also that I'd like to emphasize that Patty said, that's also really important to realize, is that tissues look different post-mortem than they do ante-mortem. And I have actually seen documented in medical records when I used to work in Florida, description of vaginal and anal injuries, which really were just documentation of relaxation of the sphincters and the anus and the vagina that people mistook as dilatation due to physical injury.
Very interesting. Thank you both for that. That's really helpful. And also brings up another question for me, which is, on the technical assistance line, I have occasionally gotten calls from SANEs who are not trained as death investigators, who have been contacted by someone because there is a decedent where they're worried about sexual assault. And they've called the technical assistance line for assistance. And usually what I do is I hook them up to Chris and Patty to walk through what that looks like. But because I know that does come up occasionally, you guys have any tips or suggestions for any SANEs who are watching this, who do get that call in the future, kind of what is the best way to handle that and to determine what's something that they have the skills to do versus what is really beyond where they need specialized training that they haven't gotten?
I guess I can start. I guess the most important thing is that if collection of a particular specimen is warranted, in that it will have important evidentiary information and evidentiary value to a particular case, and there is someone who has the skills to collect it correctly, that the focus really should be on making sure that that occurs under the right circumstances, so no evidence is lost. I think again, this hits on something that we talked about in my slides, is that sometimes death investigation in Oregon is not as well established as it should be, and so things sometimes occur in an ad hoc manner. Now, again, I don't think that that's necessarily a problem that's insurmountable. And in my mind, as long as things are sufficiently documented and everybody who needs to be involved in the conversation is involved in the conversation, then really the emphasis should be on collecting the evidence in the right way, so that it is collected and it doesn't compromise the case by not being collected. Now, if that's something that happens with a high degree of regularity, or a person finds themselves participating in the examination of deceased people more often than they thought they would, it may be worth talking to either the county DA or the county sheriff, depending on how the ME system in that county is organized, and seeing if it's worth getting them appointed as an MDI. Because in my mind, that's the risk that I see associated with that, is that you have someone that's not necessarily established and appointed as someone who has basically been given permission to handle a deceased person, who is then, putting their hands on a decedent. So if that's something that came up, it probably would be easy enough to address by just working to get the person appointed as an MDI so that they can rely on that, when they need it, even if they're not doing it full time.
One thing that I might add, when I have been asked to go to another county to collect evidence, I made sure that the DA signed off on that. I'm only appointed at this time in Lynn County. That means for me to go to another county, I am acting solo and not under the jurisdiction of that DA. So if you're going to go, make sure that you have crossed all your T's and dotted your I's, because nurses can't just fly out there solo. We're not appointed that way as death investigators. And the same would be true with a SANE who is not a death investigator. It's the first time that I worked with the state team that responded to a homicide, I assumed that they would be collecting absolutely everything. And when they turned to me and said, "No, you do the sexual assault," I was pretty surprised. And I learned later it was only because they knew that I was a SANE. It was not because they assumed that the death investigators would do that. But as Sean was saying, it's really important to get that trace evidence. So.
Yes, and while there are, forensic and crime scene techs out there at both the county and state level that are able to collect trace evidence, that's really more stuff that you find on the body externally. You won't find people that are comfortable collecting safe kits in the forensics labs.
And you will not have a swab dryer, all those little tools that you have at the hospital. So there are ways around that. Law enforcement's very happy to help you out with that part, as long as they don't have to collect it, and you'll help them out.
If any of the SANEs watching this are interested in going this direction, do you have any thoughts on how they might be able to assess whether this might be a good fit for them? Like attributes that you think really help with making a good death investigator, or things like that?
Strong observation skills and documentation. This is not something that, like Epic, that you click a box and you're done. That 16-page sexual assault report is much, much easier than some of the reports that I write. So documentation and observation skills, how to document.
Yeah, documentation definitely is the big one there. Our determinations and the information that we can use to render opinions on cases are only as good as what's documented in the case file. Things like informal things like conversations on the phone or conversations over the autopsy table are helpful, but they don't replace the importance of documenting things. I would also recommend that people with good communication skills participate in death investigation, because as Patty mentioned, a lot of the job is talking with families, and that can be really, really difficult. Because it's not always clear how you should approach situations like that, because it is such a difficult thing for families to talk about. And it's definitely something that it's a skill that becomes better with time and is acquired. but nothing will replace just good, compassionate communication skills when dealing with other people in a death investigation. I would also recommend along those lines, people having thick skin, because as I mentioned, you will encounter expressions of frustration and anger when you talk to people, not always just amongst the families. I mean, I've been, yelled at by people in various sheriff's offices for things that they thought that I did a poor job on. I am always happy to, sort of give the floor to family members to talk to me, even if they just want to scream at me and tell me that I did a crappy job in my autopsy or my report. It's part of the process. It can be part of closure for some people. So I tend not to take it too seriously. I just think it's more important to give people the audience that they feel like they need sometimes.
Kind of along those lines, what have you two done to be sustainable in this work? Because both of you have been doing this for quite a while, and there are some serious, complications and difficulties and trauma that you deal with as part of that. What do you think has kept you going?
I can start, I guess. I think in general, and this isn't necessarily a comprehensive strategy and not something that I think can stand on its own. But I think people who have gone through medical training tend to be pretty good at compartmentalizing, and don't necessarily, or at least have a little bit of a greater defense against, bringing things home with them and having sort of a clear division between like the stuff that you see at work and the stuff that you do at home. I will say that for me personally, consistently, or participating consistently in the things that I like a lot, tends to keep me centered. So, I try to stay as physically active as possible, which admittedly was a little bit more difficult during COVID. My wife and I, as I was sort of alluding to before, we also are very, very active in animal welfare organizations. And so we will foster a lot of dogs and cats and always generally have some type of animal in our house at any point in time. So that too makes me feel, I think, a little bit better when we have cases that can be particularly traumatic or particularly disturbing. And then finally, not to sound too cliche about it, but I learned to bake when I was very, very young. And so being an avid baker and sort of planning weekend projects and things like that has always been helpful for me. I know that was a big deal during COVID, but yeah, it works for us.
For me, I do a lot of talking to my peers. I've talked with Nicole, not so much about death investigation, but sexual assault exams. And I happen to be married to one of the county MEs, assistant ME, and we talk about it over supper because he's also a physician, so he's used to those kind of conversations. But as Sean was saying, doing things that you like, frequently Peter will say, why don't you go sew for a while? Why don't you go sit in front of the sewing machine? Or I also take advantage of the chaplain, the police chaplain, and the chaplain at the hospital that I use those. Not use them, but I communicate with them a lot when I have a case that really, really bothers me. So, and it's not the horrific cases that many people think that it would be. It's usually a family member that something touches me or something like that. So, and it's knowing when you are getting close to your limit and knowing that you should do something about finding somebody, getting away for the weekend, or I will call on my peers, and I'm lucky. I don't think Sean could do this, but I will call on the other death investigators and say, I need a day off. So we do that with each other.
And Patty, could you elaborate a little bit more on the chaplain too? Just because I know you've gotten questions in the past about, like, are they a specific denomination, or if I'm religious, is this are they still an option for me? And I just thought that might be interesting for you to go into a
Sure.
little bit more.
They can be religious or they may not be. The hospital chaplain has a religious background or is actually a minister. I don't think I've ever seen him be, as we say, godlike with us. He just puts that on the wayside and lets you talk and doesn't get into praying and that type of thing. Law enforcement chaplain are the chaplains for first responders. They do not have a religious affiliation, but they do have a background primarily in being great with crisis work. One that I work with quite a bit was a former paramedic. Another one was a funeral director. So another one was a social worker. We work quite a bit with the chaplains out of Marion County also. So they can be from any walk of life. They do not come out to be religious with people. So.
Thanks for going into that. I appreciate it. Also, I'm not sure how much of this is a question that you both can ask, but given that Ken had to step away and deal with a call, are there any aspects of kind of his practice and the system that he's under, just like the overall model, that's different in a way that you would feel comfortable just talking about, that people know more about some of what else is out there?
I guess I can provide a little bit of background for that. Yeah, Ken is a bit unique as he bounces back back and forth between a couple different counties. One county and Polk County works very similar to Lynn County, in which you've got, a handful of, cross-trained MDIs that do other things with the county ME. Whereas Marion County functions similar to the counties you'll see in the Portland metro area, in that they do have full-time death investigators, and their system is structured a little bit differently because it's basically better funded. So the difference in terms of his practice, I suppose, is that one thing that I've noticed is that, he's picked up a lot of good habits from Marion County because, they do a pretty comprehensive job. And so I think he has taken that to Polk County and that's rubbed off on a lot of the other investigators in the county, which is a good thing. But it emphasizes, I think, the idea that, generally there's always room for improvement in the different county systems. And I don't know of a single county out there right now that would tell you that they have enough people for their death investigation systems. There's always, room for people to work in the system and help out.
I feel like that's such a common issue, unfortunately. And Curly just flagged me that Ken actually was able to join us again.
I'm back.
Oh, good. He can speak for himself.
So Ken, I'm not sure at what point you came back in, but both Sean and Patty went through a little bit about like how the systems that they're in work. And so I just wanted to give you a chance also to talk about kind of what your day-to-day looks like and the system that you work under.
Okay, with Polk County, it pretty much mirrors that of Lynn County, as we do have a physician that we work with that signs the death certificates. If we're on a call and we have any questions, we will call him, have a consultation as to how he feels the direction should go. As in Lynn County, all deaths are investigated by us. I'm sure Sean has gone over all that. I'm not too sure what more specific I can do or share. If we have any questions at all, like I said, we'll call our doctor. If we're unable to get a hold of him, or if it's obviously a suspicious death, I will call the on-call pathologist at the state. There's like 4 of those individuals, and I'll have a consultation with them hey, what do you think about this? I'm really confused about this unexplained bruising to the side of the victim's head. Say, well, and they'll help us explain maybe what I can't see or understand. If anything, they'll say, let's just send the body up to Portland for a post-mortem, draw blood urine for toxicology, just to help us rule out what it's not. So.
Thank you. I really appreciate that. And because if you don't mind, I'm going to ask you a question that I also already asked Sean and Patty, which is what keeps you sustainable in this work? What keeps you going? I actually don't know how long you've been doing this, so maybe that would be a good place to start.
Well, I've been in emergency services for 30 years as a paramedic.
Wow.
And as a paramedic and as a nurse in a hospital, it's go, go, go. We have to take care of this person. We have to make this person survive, which puts on me a lot of added stress and emotion. With a death investigation, we're past that. We're now going to help the family find closure. What's the cause? What's the manner? How did this situation happen? And to me, I find it easier because I'm working with the family and helping them grieve through the process instead of the stress of trying to save the person. So I don't know if that makes sense at all, but being in the emergency services for 30 years, I see the same amount of stuff, the same kind of situations in the field as a paramedic as I do as a medical examiner. And then I just have a lot of support group, people who I can talk with, oddly enough, my wife, my kids, adult children, that is, and a very good friend who also works in emergency services. So.
That's awesome. Thank you.
Nicole, I just
Yeah.
wanted, Ken brought up something, with live people, it's hurry up and take care of them. With death, it's slow down.
Right.
And really look, if you're on a scene, you don't want to mess up any of the evidence that's around the body. So it's totally, I don't look at the body until close to the end. I look at the rest of what's going on around the body. Are there notes? Are there medical discharge instructions, that kind of thing?
That's an interesting distinction. I'd never thought about that, but that makes a lot of sense.
Yes, I spent many years in the fire service as a arson investigator, and I kind of take the same approach where you start from the outside and work your way in. So I do a 360 of everything, then work closer and closer to the decedent. And the last thing I do, like Patty said, I do a hands-on exam and then concentrate my last step with that physical examination of the body.
Well, I just want to flag that we just have about 15 minutes left. So if folks do have questions that are coming up, I would get them in the chat now to make sure we have time for them. Otherwise, I've got something else I wanted to ask about, which is, and I don't, just kind of clarify from the beginning, I don't really have like a clear question about this, but I really, really appreciated Sean's point about death investigation being more about public health rather than public safety, and just what an important part of public health it is. And so I was just wondering if there's any additional thoughts that folks had on that or wanted to elaborate on it, because it seems so applicable for our audience right now in particular.
I think the biggest thing is just the misconceptions surrounding what medical examiners do. That's one thing that I've found myself doing in the last few years, is providing people examples of how we could and probably should be participating in various public health discussions, particularly concerning mortality trends. Now, this may be forced, I don't want to say out into the open, but this discussion may be pushed forward by default in the next few years, because we're finding ourselves being asked increasingly detailed information about the statistical side of our cases. So a good example of this is the recent heat wave that the state saw, which resulted, unfortunately, in quite a large number of deaths in the Portland metro area. And I don't know how closely people follow the news, but you'll see that recently we actually lost an appeal to the Attorney General's office to release a lot of information about each individual heat-related death. And on the heels of that, we've been, again, being asked to provide in-depth statistical analyses of these that we just really don't have the people to dedicate to. So, I'm hoping that we can leverage discussions like that to further advertise ways that we can participate in the public health system to really, again, establish that this work has public health benefit, because I think that's basically the short way to getting it funded better.
I think another is absolutely what Sean said. One of the things that we've been dealing with in our county is all the drug overdoses, which I know is in every county, but every once in a while we hear from law enforcement, oh, we found 100 pounds of GHB coming in, earmarked for OSU. So if we can get that information out to the public, that be watching, be concerned about, or the Percocet, it's the pills that are marketed as Percocet and they end up being fentanyl. Those accidental deaths occur much more frequently. So any information we can get out and work with the public health department with their needle exchange programs, with their Narcan, Naloxone programs. It's helpful to the public and to parents. Pardon?
Oh, no, I was just going to say, I think that's a good point, because the overall goal here is logical, targeted interventions that make sense. And there aren't too many examples of this because, again, I think, in the United States, death investigation surely has been underappreciated. But there are a few, and they're worth keeping track of. Nationwide, a lot of consumer product safety issues that have been identified come from medical examiner data. So the most recent example of this would be the recall of a couple different types of boppy pillows that were sold, as they had directed or contributed directly to a handful of infant deaths. And without good solid death investigation to link these deaths to those particular products, that association never would have been noticed. Closer to home, Washington County has done some really good work in preventing suicides and designing suicide interventions based on trends that have been identified in their investigator reports as their death investigators have responded to suicide calls. So it does happen. It's just a matter of collecting these examples and really working to advertise them publicly.
And to build on that, Sean, one of the things that I do also through the county is I serve on the child fatality review. Each county has them, and there's also a state review board. But part of the big part of what we look at is how could this death have been prevented? Was there something that caused this death? And what education could be done in the community? So and also then there's the suicide prevention. So.
That all makes a lot of sense. Are there things that we can do, those of us who are watching, to help kind of promote that view on things, or promote additional funding? Is there like a write your congressperson, or is there a place that we can keep an eye out, things like that?
I mean, it sounds silly, and I know people joke about it, but really, I mean, that's an effective avenue. Whenever I take a phone call from a family member that really wanted an autopsy on their loved one that we're not able to provide, because we can only really provide that service to probably about 20% of the total number of deaths statewide that fit ME criteria every year. And unfortunately, it's more common these days that we decline cases that aren't directly related to the criminal justice system. That's because we don't really have the resources to devote to things like family requests or, you know, natural deaths in people that are maybe a little bit younger than they should be when they die, which unfortunately does affect families and does affect, I think, how people achieve closure when it comes to this. So, you know, when I have those difficult conversations with family members, they want to know, you know, why we didn't take that step. You know, I'm always very honest with them, and I tell them exactly what the situation is. And I do recommend that if they feel like that they've been harmed by the inadequacies of the system, that they follow up with their elected officials, because it's letters of support and it's recognition of the work via members of the community that help us out a lot.
Thank you for that. Yeah, writing elected officials, you're right, it almost becomes like a rote, you know, like phrase, but it really does make a difference. I mean, my time at the task force has certainly taught me that, so I appreciate that.
Well, I mean, it's true. I have had conversations with elected county commissioners because of certain cases, again, that we weren't able to accommodate. So it does help, I think. And I think as much as we can have those conversations, even though they are difficult to have because we're identifying our failures, I think it's important.
And like Sean said, I spend quite a bit of time explaining to patients, survivors, why an autopsy wasn't done. Invariably, with most of the deaths, I'm questioned about why isn't there going to be an autopsy. So,
Got to be a hard conversation. Well, we're going to start wrapping up here. Aislinn is going to put a link to an evaluation for the session in chat, and it's also available in the agenda. We really encourage folks to take a few minutes to fill that out. Let us know your thoughts. And if you are a nurse, that is also how you will get continuing education credits. And before we, fully wrap up here, any last thoughts from any of you?
I just want to say thank you for being given the opportunity to talk to everybody today. Any chance that I am given to cue people in a little bit to what we do and why I think it's important, I think that those are good conversations for us to have, and I always try to take advantage of them. So thank you.
Well, thank you for being here and for sharing your knowledge. Again, I know I learned a lot, and so I anticipate lots of other people did too. Any other last minute thoughts from Patty or Ken?
No, other than I think most of you know how to reach me at the task force. It's patty@OregonSATF.org. So.
Thank you.
And I would just throw out, if anybody's interested in helping that out, becoming an MDI, to let Patty and I, or even Sean know, because there's a lot of counties who scramble for investigators.
Yeah, I appreciate you all being a support for folks who are interested in that, because I always hear from SANEs who are interested in pursuing this. So contact information can also be found through the HUVA website for everyone. And if you have any questions, just reach out and we can also get you hooked up with folks. But we will leave this open just a couple more minutes in case people need to access the evaluation link or have a last minute question. But besides that, I'll declare the session at a close, and thank you three so much for sharing your insights. Really great. I appreciate it.
Thank you, everybody.
Okay, I'm going to go ahead and close this out. Thanks, everyone. Have a great day.